Welcome to Eastern Oklahoma Orthopedic Center. My name is Dr. Rodney Plaster, and I specialize in joint replacements of the hip and knee. In this video, I will be discussing advancements in total knee replacement. In general, there are two different methods of doing knee replacements. The older, acceptable method that is used in the general orthopedic population is a cemented implant that the cement will penetrate the bone, harden, and hold the new surface in place. There's another technique where we use porous materials that allow the bone to heal and grow into the back of the implant. When we remove the joint surface, the worn out cartilage, the bone thinks it's been broken, and it will actually heal to the new porous knee surfaces. We use that in younger patients, and it is not a new process. We've been using that for 25 years. The orthopedic industry is predicting in the next 5 to 10 years that knee replacements utilizing Ingrowth technology will be used in all younger patients. And that is because it's a physiological bond. It's like a muscle. As you work muscles, the muscle will get stronger. When the bone grows into this porous material, the more you use it, the stronger that bond gets. The people who I've used porous Ingrowth technology on 25 years ago have never seen their bond break down. On the other hand, cement is a very useful technique and will continue to be used in our more elderly population that is less demanding. It works quite well, especially in osteoporotic bone, and should last the lifetime of the patient. The method of fixation to the bone is independent of the design of the implant. For example, the gender-specific knee has both a porous femur and tibia, or has a cemented femur and tibia. It's still the same design with the same outcomes, but just different techniques of how the interface works with the bone. In the last 10 to 15 years, implants have been redesigned and improved to allow a higher degree of motion and a more natural feel. Some of these have been surgical techniques, but a lot of it has been in surgical design. In addition, the wear pad that we are currently using lasts about 4 times longer than what we had before. Other advantages in the last 3 to 4 months have included methods of pain control. In the last 4 or 5 years, we've been getting excellent pain control with femoral nerve blocks, but it leaves the muscles weak for a day or two. We are currently using a new medication that will provide local anesthetics inside the knee for approximately 2 days. This allows the muscle to be strong, but the patient to wake up with no pain at all. This has been a tremendous advantage for our patients in the last 2 or 3 months. You can expect to be out of your pain and restored back to normal activities. In follow-up studies, 96 to 98% of people have no discomfort or so little discomfort that they do not take aspirin or Tylenol for. You can expect an occasional ache, and sometimes if you twist just right, it may have a sharp twinge that goes away rapidly. But in general, you should be able to do much more than you did before having your knee replacement. That means getting back to normal activities, walking, playing tennis, even snow skiing. Over the course of the last 20 years, most primary care doctors and even orthopedists have told their patients to wait until they could not tolerate the pain any longer before they had their joint replacements. And that was because the joint replacement only lasted 12, 15 years and would have to be redone. That was probably never true to start with, but even less true today. Our new implants and our new wear materials look like they should be lasting 30 to 35 years. Because of that, we are doing hip and knee replacements in younger and younger patients. I've even done teenagers. It's very common to be doing a hip or knee in a 30, 40, and especially 50-year-old athletes who desire to return back to their level of activity. And that's very accomplishable today. To learn more about the advancements in total knee replacements, please visit our website at eooc.com. Thank you.